We think modern humans are tough. Emergency rooms, antibiotics, surgery on demand. But 60,000 years ago in the Ice Age valleys of Europe, your cousin species was healing from injuries that would kill you today. Compound fractures, skull cave-ins, arms ripped clean off. No painkillers, no stitches, just raw survival instinct and whatever the clan could manage with stone tools and plant knowledge. How did Neanderthals walk away from trauma that drops modern athletes? What does their bone record actually show us about pain, healing, and the will to live? If you value documented prehistoric archaeology like this, subscribe. It's the best way to support our work. Also comment from which city you're hearing this from. This script is researched and factual, using sources from Eric Trinkhaus's injury studies and Shanidar cave excavations. Now back to the story. Number 1. The Shanidar 1 skull sits in a museum case in Iraq. You're looking at a 40-year-old male who lived 50,000 years ago. His left orbital socket is crushed inward. The cheekbone is completely gone. The skull shows massive blunt force trauma that would have destroyed his left eye instantly. But here's what stops you cold. This injury healed. Bone regrowth around the socket edges. Smooth scarring where jagged fragments once jutted. He lived with this face for years after impact. No infection, no brain damage visible in the fossil record, just adaptation. The same skeleton shows a withered right arm. The humerus bone is half the thickness of the left. The shoulder joint never developed properly. Either birth defect or childhood injury, but he survived to middle age in a world where you needed both arms to hunt, to defend, to build shelter. His clan kept him alive, fed him, protected him. 40 years of dependency in a society we're told had no room for the weak. The wear patterns on his teeth tell another story. His molars show unusual grinding marks. Someone else was pre-chewing his food, breaking down tough mammoth meat and fibrous plant roots before he could swallow them. The clan didn't just tolerate his disabilities. They integrated them into daily survival routines. This wasn't charity. This was investment in living knowledge. His skeleton shows muscle attachment points that reveal how he adapted. The left arm overdeveloped to compensate for the useless right. His core muscles grew massive from decades of one-handed tool use. His spine curved to balance the uneven load. The bones tell you he became a specialist, probably tool-making, hide processing, fire tending, work that kept the group alive while others hunted. Number 2. La Chapelle-aux-Saints, France. 1908 excavation. The old man of La Chapelle died around 50,000 years ago at roughly 40 years old, ancient for a Neanderthal. His vertebrae tell the story of decades carrying impossible loads, compressed discs, bone spurs growing like thorns from every joint, severe arthritis that would have locked his spine into a permanent hunch. Each step would have been agony, but he kept walking. The wear patterns on his teeth show he lived years past the onset of disability. Someone else was chewing his food, pre-digesting tough meat and fibrous plants. The clan adapted their hunting patterns to accommodate his limitations. They slowed down, they carried him when necessary. They fed him soft foods when his jaw joints seized up from arthritis. His skull shows something else. A massive blow to the left temple that fractured the temporal bone. The injury healed, but left him partially deaf. In a world where hearing a cave bear approach meant the difference between life and death, he survived as a liability. The group economics don't make sense unless you factor in knowledge transfer. He was a living library. The bone chemistry reveals more. Isotope analysis shows his diet changed dramatically in his final years. Less meat protein, more processed plant matter. His teeth show micro-wear patterns from eating foods that were ground, pounded, or partially digested by others. The clan was keeping him alive with specialized food preparation that would have taken hours of daily effort. His hands tell the final chapter. The finger bones show arthritis so severe that gripping would have been impossible. But they also show unusual wear patterns on the fingertips, smooth polishing that comes from decades of detailed work. He was still contributing, still processing materials, still teaching younger clan members how to work stone, prepare hides, maintain fires. Number 3, Krapina Cave, Croatia, 800 bone fragments from 24 individuals, but one femur stands out from the collection stored in Zagreb. A compound fracture that broke completely through the thigh bone. The break is clean, probably a fall from height or a mammoth kick. In the wild, this injury kills within days from blood loss or infection. This bone shows something unprecedented. Callus formation. New bone growth bridging the gap. The leg healed crooked, shorter than before, probably with a permanent limp. But it healed. Someone set the bone, someone immobilized it for weeks. Someone fed this individual while they couldn't hunt or gather. The healing process took minimum 6 months of complete dependency. The angle of the healed break suggests primitive splinting, probably wooden stakes bound with hide or plant fiber. The bone alignment is too good for random chance. Someone understood that keeping the pieces together improved outcomes. This isn't instinct. This is learned medicine passed down through generations. The muscle attachment points show how the leg adapted. The good leg overdeveloped to carry double weight. The hip socket on the injured side shows wear patterns from walking with a permanent limp, but the wear is extensive. Years of walking after the break healed. This person didn't just survive, they remained mobile. Cut marks on nearby bones suggest the clan modified their hunting strategies. Smaller prey, trap-based hunting that didn't require long pursuit. The injured member probably became a specialist in ambush tactics, weapon maintenance, or processing kills. The group reorganized around the limitation rather than abandoning the individual. Number 4, Shanidar 4. The flower burial. Same cave system as Shanidar 1. A male who died around 46,000 years ago. His ribs tell a story of repeated trauma, multiple healed fractures, old breaks that mended crooked. Each rib shows evidence of blunt force impacts that would have collapsed the lung. But the real shock is his spine. 2 vertebrae show compression fractures that healed incorrectly. His back was permanently curved. Standing upright would have been impossible without constant pain. Yet he lived for years after the initial injury. The bone shows extensive remodeling. His body adapted to the new alignment. The soil around his burial contains concentrated pollen clusters, 7 different flowering plant species, pine branches, yarrow, cornflower, grape hyacinth. Either this burial happened in spring with natural pollen drift, or someone placed specific plants around his body. The pollen concentrations are too high for random deposition. Someone cared enough to mark his grave with flowers. His teeth show another adaptation, unusual wear patterns from using his mouth as a tool, probably compensating for limited arm mobility from rib damage. The enamel is worn down to the dentin from gripping hide, plant fibers, even stone tools. He lived as a specialist, the clan member who handled detailed work that required steady hands instead of physical strength. The rib healing patterns reveal something crucial. The breaks happened at different times, years apart. This wasn't one catastrophic injury. This was a lifetime of accumulated trauma. Each time, the clan invested months of care in his recovery. Each time, he found new ways to contribute despite growing limitations. Microanalysis of his bones shows periods of malnutrition alternating with good health. The clan shared food during lean times, but couldn't always provide optimal nutrition. Yet they kept him alive through multiple famines. Multiple injuries, multiple recoveries. The investment in his survival was enormous. Number 5, Tabun Cave, Israel. A female skull dating to 55,000 years ago. The frontal bone shows a healed depression fracture. Something hit her forehead hard enough to crack the skull inward. The impact zone is roughly circular, probably a thrown stone or club blow. The healing pattern tells you everything. Smooth bone regrowth, no signs of infection, no brain tissue damage visible in the fossil record. She survived what should have been a fatal head injury, but the real revelation is in her teeth. They show decades of wear after the injury. She lived at least 10 more years past the skull fracture. Her jaw shows adaptive changes. The bite pattern shifted to compensate for probable vision problems from the head trauma. One side shows heavier wear. She was chewing mainly on the right to avoid pressure on the damaged left orbit. The clan adjusted her food preparation. Someone was pre-processing tough materials, so she could eat without triggering pain. The tabun deposits contain stone tools with blood residue still preserved in the microscopic scratches. Protein analysis shows human blood mixed with plant compounds: yarrow, willow bark, chamomile. These aren't food plants. These are medicinal preparations. Someone was treating injuries with plant chemistry 40,000 years before recorded history. Her pelvis shows she gave birth after the head injury. At least 2 children based on scarring patterns in the pelvic bones. The clan didn't just keep her alive, they integrated her into reproductive strategies despite her disabilities. Her genetic line continued, her knowledge passed to the next generation. Number 6, Saint-Césaire, France, a skull fragment from 36,000 years ago. The temporal bone shows a puncture wound that penetrated completely through the skull wall. The hole is perfectly round, too clean for animal claws, too precise for accidental trauma. This looks like a spear point that went straight through the head. If you value documented prehistoric archaeology like this, subscribe. It's the best way to support our work. Also, comment from which city you're hearing this from. This script is researched and factual, using sources from Jean-Jacques Hublin's trauma analysis and recent isotope studies. Now back to the story. The bone around the puncture shows healing, new bone growth around the edges, smooth scarring where jagged fragments once protruded. This individual survived a spear through the brain and lived long enough for the skull to heal. The healing process alone would have taken months of intensive care. But here's the impossible part. The entry wound is in the left temporal region. Modern neurosurgery tells us this should have caused immediate speech loss, right side paralysis, and probable death from brain swelling. Yet the bone shows years of healing. This person adapted to massive brain trauma and remained functional enough for the clan to invest in their survival. The skull fragment was found with stone tools showing blood protein residue. But not just any blood. Chemical analysis reveals a mixture of human and plant compounds. Willow bark contains salicin, the precursor to aspirin. Birch bark contains betulin, an anti-inflammatory. Someone was treating this head injury with plant-based medicine 50,000 years before recorded pharmacology. Number 7, Vindija Cave, Croatia. A mandible dating to 32,000 years ago. The jaw shows evidence of surgical intervention. 2 molars were deliberately removed while the person was alive. The extraction sockets show healing patterns that take months to develop. But removing teeth with stone tools should have caused fatal infection or blood loss. The bone around the extraction sites shows something unprecedented. Smooth healing with no signs of infection. Someone understood how to control bleeding, how to prevent sepsis, how to manage pain during a procedure that would challenge modern dentistry. The healing patterns suggest the person lived at least 5 years after the extractions. Why remove healthy teeth? The surrounding molars show severe wear from grinding tough materials, probably processing plant fibers or preparing hides. The extracted teeth were creating overcrowding that made chewing impossible. This wasn't emergency medicine. This was preventive surgery designed to maintain long-term function. The jaw also shows cut marks from stone tools, not random damage. Precise incisions that suggest someone was accessing the tooth roots for complete removal. The cuts follow the natural anatomy of the jaw. Someone had detailed knowledge of facial structure and surgical technique. Number 8, Pontnewid Cave, Wales, a collection of teeth and bone fragments from 200,000 years ago. Earlier than classic Neanderthals, but showing the same pattern of injury survival. One skull fragment shows a healed scalping wound. The cut marks follow the hairline exactly. Someone survived having their scalp partially removed. The healing pattern reveals the injury happened during childhood. The skull shows decades of growth after the initial trauma. This person lived to full adulthood, despite massive head injury during their developmental years. The clan invested in a child's survival even when the outcome was uncertain. Microscopic analysis of the bone surface shows tool marks from multiple stone implements, different cutting angles, different blade sharpnesses. This suggests either multiple attackers or someone providing medical treatment with various tools. The healing patterns favor medical intervention over combat trauma. The teeth associated with this skull show unusual wear patterns. One side heavily worn from compensating for probable facial nerve damage, the person adapted their chewing patterns to work around injury-related limitations. They lived long enough for these adaptive changes to become permanent. Number 9. Feldhofer Cave, Germany. The original Neanderthal discovery from 1856, the skeleton that gave the species its name. But recent reanalysis reveals details missed by 19th century paleontologists. The left femur shows evidence of a massive soft tissue injury that healed without infection. The bone surface displays unusual scarring patterns, deep grooves where muscle attachments tore away from the bone. This suggests trauma severe enough to detach major muscle groups from their anchor points. In modern medicine, this injury requires immediate surgical repair or results in permanent disability, yet the healing patterns show complete recovery. The muscle attachment points rebuilt themselves. New bone growth created stronger anchor points than before. This person not only survived muscle-tearing trauma, but came back stronger. The healing process would have required months of complete immobilization and intensive care. The pelvis shows he lived well into middle age after the leg injury. Probably 15 to 20 years of active life following trauma that should have been permanently crippling. His teeth show he maintained normal diet throughout the recovery period. Someone was providing processed food during the months when he couldn't hunt or gather. Each case rewrites what we think we know about prehistoric survival. These weren't isolated incidents. The Neanderthal bone record shows systematic injury treatment across 50,000 years and 4,000 miles of territory. From Gibraltar to Siberia, the pattern repeats. Compound fractures healed with proper alignment. Skull trauma survived without brain damage. Spinal injuries managed through group adaptation. But here's the reveal that changes everything. Recent excavations at Cima de los Huesos in Spain have uncovered a mass grave dating to 400,000 years ago, 28 skeletons showing evidence of systematic care for disabled individuals. One skeleton shows severe spina bifida that would have required lifelong assistance. Another shows complete blindness from birth trauma, yet lived to adulthood. This isn't Neanderthal behavior. This is their predecessor species doing complex medical care 8 times older than we thought possible. The capacity for healing, for keeping the wounded alive, for adapting group behavior around individual limitations. It runs deeper than our species. It runs deeper than intelligence as we measure it. The Cima bones contain chemical traces of medicinal plants, concentrations too high for dietary consumption. Someone was treating injuries and disabilities with systematic plant medicine 400,000 years ago. The same compounds found in Shanidar Cave, the same treatment protocols separated by 300,000 years of evolution. Ice Age survival was never about the individual. It was always about the group that refuses to let you die alone.